Hi, this is Dr. Kris from Ample Nutrition, and today I'm filming live from my home with our brand new puppy, Cosmo, who is 8.5 weeks old. I know that many of us have benefited from being home a lot these days, and many of you have added a puppy to your household or plan to. So today we are going to talk about what you can begin doing at home now with your new puppy or even adult dog, so your pup can have low stress veterinary visits, positive grooming experiences, and you can really have fun and an enjoyable time taking care of your new puppy. Working with your puppy now, just a few minutes a day to change what may feel unnatural now to natural and comfortable will set you and your pup up for a lifetime of success. So it is so natural to cuddle, to kiss, to snuggle and pet our babies' bellies, to pet behind the ears, on top of their heads, but it's not necessarily natural for us to pet inside their ears or their mouth or their tail area or their paws. But we do need to spend time in these unnatural areas so our puppy is not frightened or uncomfortable when you or a veterinarian or a groomer touches or needs to treat these areas. You're essentially practicing desensitization. So what was fearful or unnatural becomes perfectly natural and safe to them. So what I like to do is begin with kind of oral work. And what I'll start to do is just put my fingers around their chin, around their lips, and I'm gonna work my fingers into their mouth. And it may not be perfect the first time. You know, you wanna be able to open their mouth up eventually to look into their mouth in case there's something in there that they're choking on, or you have a tooth you're concerned about. You want to be able to get in there with them feeling perfectly trusting and comfortable with you doing that. So when you think about it, these are really the initial training steps to brush their teeth, to look inside of their mouth. You know, if they're choking on something, you can safely take something out of their mouth or remove an object. I've had a few cases in my practice where I've had to remove a knuckle bone or a fishing hook that's gotten caught, and it's so nice when you have that dog who has obviously experienced someone being close to their mouth. So the next thing we want to work on too is touching their ears. You know, they're not necessarily born with ear conditions or ear infections at this age, but down the road they may get an infection. You may have to clean their ears or potentially treat them. So if there's time during the day where you can be petting them, but also sticking your fingers into their ears, it's extremely important so that they're comfortable when perhaps you might need to get in there and clean them or give them eardrops. Also, another important area of their face is their eye area. And I like to practice touching their eyes, getting them used to my fingers around their eyes. And you can see Cosmo is working on this. We're both working on it every day. But there may be a point in time where I may need to put eye drops in their eyes. I might need to clean the tear stains out of their eyes. So what you want to do is have some time with your puppy to practice that feeling that might feel slightly unnatural right now. The next place I like to kind of work on is touching their legs and moving all the way down to their paws. Eventually you want to be touching their toes and their nails. And you can see Cosmo is totally brand new on this and is all about the treats, but doesn't necessarily like me putting pressure on his toes or his nails or just even looking at them. This is what you want to be practicing every day with them so that they get used to that touch. You can eventually even touch the toe area with nail clippers, not necessarily clipping their nails at that time, but just introducing the nail clippers so it's not something that they find is frightening or unfamiliar. And when you get to the point where you can bring in the nail clippers, you can just cut the tips of the nails. So just small little, very close to the tip cuts so that they get comfortable with that sensation. And if they don't like it and they pull away, that's okay, they're just not ready. But that just means we just keep practicing it. It's okay. You gotta have patience with them. I always tell clients, if you are at home practicing this and you do accidentally clip the nail close to the quick and it begins to bleed, is my go-to if you don't have any styptic powder on hand. You can use cornstarch, you can use baking powder, you can use flour to just help stop the bleeding. But you really, if you can, try to avoid having that experience. You just really want to be cutting the tip so that they get used to that vibration and sensation of the nail clippers. So the next thing you want to do is just pet them and touch the back of their area here, all the way down to the tail area. You want this to be totally normal for them. Touching their tail, slowly pulling their tail into your hands, and you just want treats, don't you? You just want treats. But when we go to the vet's office to get vaccines or to get treatments, we tend to take a temperature rectally. They may have a little bit of loose stool, and you want them to feel comfortable with you cleaning back there. So the next thing I like to do is to introduce a comb, or you can introduce a hairbrush at this point. You have to realize though, when puppies are very young, they're extremely sensitive to the bristles of the brush. So what I will do is just let him see it, and I'm just going to use the back of the comb. I'm just going to kind of rub it against the legs, rub it against the back, and look, he's kind of going, what is that? But this is going to be a normal thing that he sees. So once you get used to it, then you can turn it over and start brushing him. And that will help with keeping his coat clean between baths, or removing foxtails or burrs if they, get out. What do you think about this comb? Do you like it or not? You'd rather have the treats, wouldn't you? Yeah. The next thing that I like to do, which is extremely important for veterinary visits, is constantly working with the sit command. Not only the sit command and telling them to sit before you give them a meal, before you give them a treat, before you let them outside to go to the bathroom, is even putting them in a position like this, back and forth, just a little bit. Good boy, good boy. Do you want to come and sit? Good boy, good boy, yes, good boy, come here, come here. Can you come sit? I know, you're kind of in my lap. But just bringing their neck up and having that be a comfortable position. He's still working on that, and that's okay. But down the road, when you need to do a blood draw at your veterinarian's office, this is where we typically grab the blood, and it's a very painless area, but having them be able to put their head up for us is extremely helpful. And a lot of times you can just take the treat and have their head go up like that, and we can practice that position. So practicing this a few minutes several times a day will really set you up for a lifetime of low stress procedures, not only at the veterinarian's office, but for grooming visits, for nail clipping, for ear cleaning, physical exams, and blood draws. I really hope that you found this video informative, and I hope you will do this with me as I'm going down my path with my own puppy. At Ample Nutrition, our goal is really to help create the happiest, the healthiest life for you and your pet. So please comment below with anything you found helpful with your pup. Anything that's not working, let me know. And don't forget to like and subscribe to our Facebook and YouTube communities to connect with me often. Hope you have a great day with your pup.